Ms. Sekhar and her family have been active members of our community in the past, and we're so excited to have her speak for us today. Ms. Sonia Sekhar is the current Deputy Director of the New York State of Health, New York's official health plan marketplace. In this position, Ms. Sekhar leads research and analysis on a range of policy issues and serves as a policy lead for the technical implementation of state and federal changes to qualified health plans and the basic health program in New York. In addition, Ms. Sekhar helps oversee plan management, financial management, budget development, and outreach and education activities at the New York State of Health. Ms. Sekhar has experience working on health policy issues at the federal and state level, including at the Center for American Progress, the White House Office of Health Reform, and Colorado's health insurance marketplace. Ms. Sekhar received a Bachelor of Arts from Barnard College and a Master of Public Policy with a health policy concentration from Duke University. Welcome, Ms. Sekhar. We're so excited to have you speak for us today.
Thank you for having me. It was really helpful to hear sort of where you all are in your own journeys and what you're interested in getting in. I don't think I heard anyone say public policy, but I did hear some health. So I'm happy to chat about that in this context. So I guess thinking back to when I was your age, a very, very, very long time ago, I went to Watkins Mill High School in Montgomery County. And I guess like I also was interested in health and to become a doctor, probably in part because a lot of in our community, I think that is like a highly coveted profession. So when I was in high school, I actually interned at NIH, and maybe some of you do that now. But I guess my first piece of career advice is that if you're ever interested in a field, um, to the extent that you can get an internship or shadow someone in that field to see if that's what you really want to do, I think that's extremely helpful. I interned at NIH, the National Eye Institute, I think for 4 years during high school and college. And it was a great opportunity, but I think ultimately I discovered that this was not really a career for me. So I think, in every experience you have, even if you learn that it's not something you want to do, I think it's extremely valuable to learn that, especially when you're young and not when you're midway through your career with a family and children, for example. So as I said, in high school, I interned at NIH, and then I continued that in college. And I think I was very interested in pursuing applying to medical school. That was sort of my initial goal. And so part of what I did in a path to that is I volunteered at a hospital in New York City where I went to college. So I went to Barnard College, which is uptown in New York City, and I volunteered at Harlem Hospital, which is a public hospital. And New York City has one of the biggest the biggest public hospital system in the country. So it serves primarily individuals who are lower income. At the time, this was sort of pre-Affordable Care Act. So in the early 2000s, the majority of our members at the hospital were uninsured, or their children had health insurance, but the parents didn't. So a lot of what I did there was talk to families about how we could help support them outside of health. So the sort of thesis of this volunteer organization I was part of, which is now called Health Leads, was that there's a strong correlation between poverty and poor health. And while giving people access to healthcare is certainly really important, I think a lot of research and literature shows that what really impacts people's health is their socioeconomic status. So their access to good food, their access to stable housing and jobs and all of these other things. So the purpose of our college volunteers was to really help people access those other resources to help promote their overall health. And I think on this journey, I was helping people, apply for Medicaid, apply for food stamps and things like that. And what I discovered in that process was how difficult it is for anyone to apply for those benefits. And I was going to, a top school, and I was struggling with this process. So when you're working with people who aren't as educated, people who are immigrants who have a language preference other than English, it is a very challenging environment to navigate through. So, and in this process, I really discovered that like I was very passionate about this. I also discovered that all the classes involved in the pre-med process, I did take many of them. I didn't really enjoy it. I wasn't, really, I felt like there's got to be something I'm better at in this world. And it was not like physics. I was I was not good at a lot of these classes, but more than that, I just wasn't enjoying it. And so I really pivoted in college to shift my coursework towards what I was really interested in. And I was pretty good at economics, and I was really interested in history. And so that sort of culminated in my policy career, I'd say. I wrote my senior thesis about infant mortality in Harlem and how that was related to some of the policy and historical events that were happening at the time. And that's how I knew this is sort of the path I wanted to go down. And while I was in college, I also interned at the Clinton Foundation, which was at the time had a big office in Harlem, right near Harlem Hospital, actually. And so in that, I started my first kind of foray into policy related work. And when I graduated from college, which was unfortunately in 2008, the job market was very bad for people because of the Great Recession. And I came back to Maryland and I interned on Capitol Hill. And I interned at the US Senate Committee on Health, Education, Labor, and and Pensions, I guess. And I was in Senator Kennedy's office as an investigations intern at the time. And there I started to get, into the legislative process and sort of the origins of that, which is often an investigation. So you investigate different problems, and that's the basis for a lot of the bills that come to Congress is the findings from investigations. And from there, I went to the Center for American Progress. And at that point, so I was working in on the Hill at the end of the Bush administration. And then I transitioned to the Center for American Progress when President Obama started in 2009. And at that point, really, the whole focus of health policy was really getting health reform passed. And that was a really great role. And I think you all and we are all lucky to be from the DC area because there are a lot of great opportunities available in DC for young people to really get into substantive work. So as a research assistant at the Center for American Progress, I got a really great opportunity to look at health from a lot of different perspectives. So I looked at the delivery system, so hospitals and other healthcare providers, and some of the issues that they face. And I'm sure all of you know, as many aspiring doctors, that the United States spends the most on healthcare out of everyone in the world, but scores among the lowest in health outcomes. And so I think that is a big focus of research in the US. Another area is coverage, is that, again, as one of I think the only industrialized country that does not have a form of universal coverage, that is still true today. So those were some of the areas, and the other big area is more of a public health topic of obesity. So I was also looking at obesity and the impacts that poverty, for example, has on the share of people with obesity. And then, but the main focus was really health reform. So we were really trying to cover as many people as we could. And so we reached the finish line on health reform. And so a lot of what I was doing at CAP was putting together like issue briefs and other material that members of Congress could use to sort of make the case to their constituents and their peers that we needed to pass the Affordable Care Act. And then after the Affordable Care Act became law in 2010, I moved to the White House Office of Health Reform. And my role there was kind of a dual. I was still like a junior staffer, but my role was really a dual role of policy and communications, which I'm sure you could see every day in the world today. It's really hard to be doing policy work and be advancing policy that you can't really communicate well to the world. So that was part of my role there. And there we were, since the law passed, the next step in the process is really the government has to issue regulation on how the law should be implemented. And the biggest part, which was expanding coverage to people through these health exchanges, so a place for where people could apply for coverage. And that work was being done at the state level. And so we were putting out regulations about how those exchanges should look and what the rules are, eligibility, and all this stuff. But ultimately, we were very removed from what was actually happening on the ground. And I guess at that point, I decided that I thought I wanted to work at a state level so I could actually see the policy get translated into real life coverage for people. But I also felt like I needed to build up my skills to be able to, really get technical. So that's when I applied to graduate school. So that was maybe like 4 or 5 years after having a job, I applied to graduate school. And at Duke, I really focused on building my technical skills. So there were a lot of content-based classes, and then there were like statistics and economics. And I focused on taking those technical classes because those are things that are harder to learn on the job than, some of the content-based classes. So that was my focus there. And then I was also focused on finding opportunities at the state level. So at that point, I was able to work in Colorado's marketplace. And so I was there right before they launched, which was really exciting, and setting up some of their, it's a kind of a technical area, but basically one of their operational areas, I was helping their team set it up. And then after I graduated, I was looking for an opportunity, and I finally came to New York. So I've been here for almost 10 years in New York, and I started out on the policy team, which is essentially, policy development, coming up with new ideas that the state could pursue to primarily expand coverage, but there were other areas we looked at as well. And over the years, I've sort of advanced in my career, and now I'm the deputy director. So in addition to policy work, I also oversee a lot of the operations of the marketplace, which includes our budget and our finances, some of our contracts, our communications, and a number of the areas that you mentioned in my intro. So that's sort of the high level trajectory that I've been on. It's been really exciting, definitely ups and downs of policy, but I'm happy to sort of take this in whatever direction you think would be most helpful for you all. So I'll pass it back to, I'm not sure who, but one of you.
Thank you for sharing your, background story with us. If any of you guys want to ask any questions, please put them down in the chat, and either we will tell it, or Ms. Sonia Sekhar can read it off.
Thank you so much for talking about what it's like to have a career in policymaking. We had a few questions. So how would you define public policy?
That is a good question. Actually, yeah, I was looking at your slides before, and I should have started with that. So public policy is really anything that impacts the rules or process of how, I guess, society works. And and how all the considerations that go into that. So an example of public policy would be our policy on health insurance coverage in the United States. So we've decided as a society that, we think it's important for everyone to have health insurance. So the policy driving that sort of principle is the Affordable Care Act. And what that does is it provides people a path to actually access health insurance. So I think that, I guess one way to define policy is that once we've defined a principle that we all sort of generally agree on, the policy establishes the pathway to achieving that principle, more or less. That's sort of a general description.
Thank you. We also have a question from Nandana. What did a public policy degree in college look like, and what were the kind of classes you took?
So I have a graduate degree in public policy. So my undergraduate school did not have a policy degree. So usually what you do then is you do political science or you do economics, typically, if your school doesn't offer policy. There are some schools like Duke. Duke does have an undergraduate public policy path, if that's something you're interested in. But at the graduate school, a lot of the classes so they have like policy analysis, and then they have a lot of economics classes and statistics. I think that would sort of comprise the majority. I also, took some other classes in accounting, public finance. So it is sort of like a quant heavy course load.
Thank you. What are some examples of successful public policy in your experience?
That's a good question. I mean, I definitely think if you go way back, like Medicare is an example of a successful public policy. So the problem that it was solving was that insurance companies did not want to give health insurance to old people because they generally have health problems, so they cost a lot of money. So the government stepped in and provided that coverage to older people. So that's, I think, successful public policies have a really well-defined problem that they're solving for. Trying to think of some others that were successful. Yeah, I would say Medicare, Medicaid. I think the GI Bill is a bill that's identified as being highly successful because when people were coming back from the war, World War II, these are people who went into the army with, when they were in high school uneducated. A lot of people were able to go to school using the resources provided in the GI Bill. They were also able to finance buying a house. So I think, again, that's an example of a policy that was reacting to a really discrete issue. Another one that's viewed as very successful is Social Security. Social Security was passed during the New Deal after the Great Depression. So it provided a safety net for people when they retire. So I think those are just a few examples.
So you mentioned before that like people that are colleges that don't have public policies, students usually take political science. So what is the difference between those two degrees?
So political science, you'll probably end up taking more sort of broader classes about specific types of politics. So you'll take like intro to comparative politics or politics of the Middle East or something like that. I think the policy degree is definitely a little bit more grounded in writing policy memos, doing statistical analyses related to policy. So I think that's the difference, is that it's just like tied more to the actual content that you'd be working on as a policymaker. But so it is more useful if you know that's what you want to do.
If anyone has any questions, please like have the hand raised emoji on, and you can call them.
Adrian asked, what metrics do you use to evaluate the effectiveness of a policy?
So it depends on the policy, but in sort of health insurance, the first thing we look at is the number of people who enrolled in it. So I think that's highly transferable to other policy types. So if your goal is to get people to take up a certain behavior, then your first metric is how many people are actually taking up that behavior. The next key metric is how much does it cost, and how does that measure up against what you thought it would cost. And then I think, if you take economics, you learn about externalities, which means, are there any kind of like unintended consequences that are resulting from the policy you made? So something you might have read on the news is that during COVID, the federal government gave people a lot of additional benefits. So unemployment benefits, they gave them extra funds on top of it. So does providing extra unemployment benefits mean that people are not trying to find a job, for example? So I think that's another metric you might want to look at. So what internships would you recommend for high school students interested in policy? So I think, one thing, since you all live so close to Washington, D.C., I think any kind of internship, like on Capitol Hill, if they take high school interns, I think I did a lot of volunteering at like Smithsonian, just in DC. Everybody is very much like connected to politics. So I feel like there are a lot of different organizations, entities, government agencies where you could volunteer. It could be as easy as like a museum or something like that that's tied to like the Capitol. But there's a lot of internships to be had in the Washington, D.C. area, with politicians directly. So it could, in addition to members of Congress, you have county level representatives, you have state representatives. And those are all places where they are looking for free labor. So, and another great way, I mean, it's a little bit of a challenging political environment right now, but volunteering on a campaign for someone who is, aligned with your own political or policy beliefs, I think is another really great way to get connected to people, because I guess one of the greatest lessons I've learned is, and this is not just true about public policy, is a lot of your trajectory is based on your relationships that you form with people over the years. So, like my internship on the Hill, I applied for the job at CAP when I was at the internship, and I spoke to the person who was supervising me and asked, well, do you know anyone at CAP who works on this team? And that person was able to make a call for me. And a lot of the jobs I've gotten over the years are through my professional connections. And so I think working at places with good people and forming relationships with them, that's sort of your real true path to wherever you want to go.
Do you think it was better to have some experience in the workforce and then coming back to school for a graduate degree, or would you recommend to stay from undergrad, stay straight to grad school?
So I think if you're like on a professional path, like you want to become a doctor, I think given like how long that takes, it's probably best just to go straight to medical school from undergrad. But I think for other professions, to me, it makes a lot of sense to get some work experience to figure out what you really want to do before you like potentially go into a lot of debt for graduate school in America. So I think most of my classmates at Duke had some work experience going into school, and compared to the classmates who didn't, have any work experience. I think you get a lot more out of your education when you know what you want to get out of it. And it's harder to know that unless you've worked a little bit.
Karishma asked, what are some challenges you experienced on the national level compared to state, culturally and within policy?
That's a really good question. So I think like it is a pretty competitive environment in DC. Like everybody is looking to advance themselves. So I think that it can be like a little bit cutthroat from that perspective. It's also, I mean, on the other hand, it's also really great because you meet a lot of interesting, really driven people in the process. But I think you kind of have to mentally figure out where you want to be. Do you want to be the cutthroat person that's like looking for advancement everywhere, or do you want to sort of forge your own path? So I think that that's one difference between the state and national level. I think every state is kind of different. So it really depends on which state you're in. I would say the bureaucracy at both the state and national level can be very challenging. And what I mean by bureaucracy is if, I'll give you an example, like we wanted to start using like WhatsApp messaging. So I can't just like email someone saying like, let's start using WhatsApp tomorrow. Like there's a process. It has to go through like a legal review. You have to actually start a business account, get that account validated. So all the steps involved can take a very long time. And for whatever reason, I feel like it takes longer at the state level than it does at the federal. And I don't know if it has to do with maybe there's stronger political leadership. Because I guess at the federal level and the state level, you have a civil service. So those are people who stay in their jobs regardless of who's president or who's governor. But then usually above them, you have managers who are political appointees of the president or the governor, and they help direct the work. And so I think sometimes the political leadership can be very effective in pushing forward your policy goals, and sometimes they're less effective in doing that. So that's just sort of one difference. And also in New York, state capitals don't tend to be in the best places. So the capital of New York is not New York City, unfortunately, it's Albany. So I think that's one other sort of difference is you get these state capitals that are in kind of like weird parts of a state, which make it like sort of less appealing to work there. So, but I work down in New York, like in our regional office in New York City.
Nandana asked, what does your day-to-day agenda look like at your current job?
That's a very good question. So again, it depends on what's going on. And generally that varies like by season. I'd say like different times of the year, there's different things you focus on. So for example, the first quarter of the year is really when we need to get our budget passed. And that's sort of true for the federal government too, but states are actually, most states are required to pass a budget like for the full year, whereas the federal government can do these sort of shortcut things to not actually do that. So the first part of the year is around getting our budget passed. And what that looks like is really answering questions about different budget line items. We also have these big federal funding requests. They're called federal waivers for some of the programs we're interested in. So our budget year this year had a lot to do with that. Then the sort of second quarter of the year is really preparing for the following year. So we have health insurers applying to be a part of our marketplace and filing their insurance rates and things like that. The summer is a little bit slower sometimes, preparing for open enrollment, and the last part of the year is really open enrollment. But generally my day-to-day is you kind of first have to focus on anything that's really time sensitive. So any kind of work that you that really needs to get done today or this week, that's really what you start with. And then we often move on to the longer term priorities or the near term priorities for the next couple of weeks. And honestly, we don't get a lot of time for sort of thinking and other activities, but one day I aspire for that. But again, these sort of seasonal activities are really what drive the daily agendas.
Could you explain how public policy works and how it's developed and how it becomes sort of like a rule that we need to follow?
So how does it get developed? So again, like you identified the problem. So the problem in the United States pre-Affordable Care Act is that we had over 40 million people who didn't have health insurance. That's a problem because if they go to the doctor or they go to the hospital, they can't pay their bills because the bills are unaffordable. And so that was a problem. And people are dying because they're like not going to the doctor because they're afraid of these medical bills and things like that. And then there's a huge disparity between like who actually has access and who doesn't. It's very much economic. So then as a result, the next step is that usually you want Congress to take action, but states can do things too, and many states do. But in the case of the Affordable Care Act, Congress, both the Senate and the House, draft bills to address the problem in the way that they think is most appropriate. Then they have to reconcile the differences between the bills and pass that reconciled version of the bill in both houses of Congress, and the president signs it. And then the next step is actually defining how that law is implemented. And that's generally done through regulations. So once a bill becomes law, the relevant federal agencies, so in this case, the Affordable Care Act is primarily the Department of Health and Human Services. It was also the Department of Treasury and the Department of Labor. All these agencies have jurisdiction over the bill because of how healthcare is paid for in the US. And what they do is they release regulations saying different things. So it's saying like, okay, here are the people who are going to qualify for financial assistance. They will make up to this amount of money. They will have these immigration statuses, or citizenship statuses, things like that. And that's sort of where we are with the Affordable Care Act. Every year, the federal government sort of rolls out refinements of these rules over time. And some of them are tied back to like the Social Security Act. They amend parts of laws that are old. So that's generally how policy is sort of made. And then at the state level, what we do is generally the executive, so whether it's the president or the governor, has policy priorities, and people on their teams like me will help design some of the policies they want. So for example, this year we proposed to the governor's team that we wanted to lower some of the cost sharing people have to pay to go to the doctor. So like their co-payments and things like that. So we designed a policy around that. We proposed it, she approved it. And then, we followed up with the kind of logistical operational steps to implement it.
And do you think anyone in like the general public can take part in that process?
So we do have different ways that we engage the public in doing that, but there's still a lot more we could do. So there are laws that require transparency on the policymaking process. So usually the way it works with regs is that you have to release like a draft version of it first, and then you have a comment period. And during that comment period, literally anybody can comment on it. Generally, the people who do comment on it are organizations, trade groups, things like that. But we do have a lot of just regular citizens or non-citizens writing comments about regs. when we make big policy changes, you have to do public hearings too. So for some changes we've made in New York, we had to present at public hearings, and then we actually have to listen to the things people comment on at the hearing, and you actually have to respond to comments. It's a requirement of the law to respond to comments that people have. So I think in the bureaucracy, there is a lot of engagement, but I think the easiest way for a person to engage is through an advocacy group. So there are different advocacy groups that literally lobby on every topic. So being a part of one of those groups, they're very organized in how they provide feedback on policy.
You asked, how can students get internships on Capitol Hill or in local government? And what would students do in those internships?
So, I mean, really, it's like a lot of this is posted on the internet, like for the Senate side, they have a Senate employment bulletin. On the House side, they have a similar House employment benefit bulletin. And I think it's a lot of it is like contacting your local government offices and asking them how to do it, or they might have it posted on their website as well. And what you do in the internship depends on, again, it depends on what they actually need, but it can range from really clerical things to really interesting research or responding to constituents. So it's a lot of different things that'll give you sort of a flavor of what the person you're working for cares about.
What do you find most rewarding about your job?
I think it's just the number of people that we help get connected to health insurance. So in New York, we have on our marketplace, we have 6.5 million people enrolled in coverage, and that's ranging from Medicaid to private health insurance with and without financial assistance. So I think the sort of seamless coverage that, I mean, there are always some issues, but in general, we have a really good system. And I think the number of people we're able to help it's incredibly rewarding to know that you're part of something that's helping millions of people get their health insurance and their health care every day.
So do we need to learn a lot of math, since you mentioned accounting, to get a degree in public policy? Is there a certain subject that we have to kind of excel in?
That's a good question. I don't think you have to know a lot of math, but I think it makes you an asset if you know math well. And I also think it's really important to be able to understand certain types of numbers that people throw around, because I think it's really important to be able to be informed when you use numbers, to be able to question them. And also budgeting and accounting, I think, is extremely useful. It's useful, even if you were not doing policy, just as a grown-up, it's really helpful to understand budgeting and accounting in general. And I think especially in policy, where you're managing taxpayer dollars and you're managing large amounts. Like one of our waiver programs is like a $13 billion program. And so you got to make sure you can follow everything that's happening with this money to be a truly good, steward of taxpayer dollars. So, and there's a lot of people who are not comfortable with math, which makes you really stand apart from them when you are comfortable with math. And grad school, one thing that's really important is that grades do not really matter very much in grad school. So you might as well take hard classes where you're learning something, because I don't even know what my GPA was in grad school, and I don't think anyone has ever asked me. So anyway, I think it's important, especially given how much money we all pay for school, to really, it's not just about getting good grades, it's about actually learning something when you're there.
So if we in high school, would it be helpful to take a course in micro or macroeconomics, do you think?
Yeah, if that's something you enjoy, especially, I think it's great to get a flavor for that. I'll be honest, I went to going to public schools growing up, and then going to college. I went to like a college with a lot of people who went to kind of like fancy private schools. And it was a little bit of shock when I got there to like feel so much less prepared than they were. Because they got maybe a more like rigorous high school experience. So they were like used to this kind of like the amount of reading and all of that. So I was unprepared for that. But you get caught up soon. So the more sort of advanced classes that you can handle in high school, like I'm not saying like take 6 AP classes or anything. I'm just saying, challenge yourself in high school, because once you get to college, you realize it's like a lot harder than it was in high school. So be prepared.
Adrian asked, what advice would you give to someone pursuing a career in policymaking?
Honestly, like what I said before, it's about relationships. And I think in a lot of different careers, although in like medicine and things like that, it's also about like your achievement, your scores, and how you score on various tests and things like that. But in policy, I think it's about your relationships. So keep up with people when you go and intern somewhere, and after you leave, if you had good friends or good mentors there, keep up with them, like, and not just in a superficial way, but like in a real meaningful way, because if they come across a really cool opportunity, then they'll think of you and they'll reach out to you. But in general, I think it helps you in a not just in a sort of career motivated way, but in life. It's helpful to maintain strong relationships with friends, with classmates, with mentors. I think mentorship is really important. Like if you're able to find people who that you can use as a sounding board, people who will advocate for you, people who will give you constructive feedback on how you're doing, like that is very useful, and will really help you. Whatever, it doesn't matter if you're going in policy or medicine, like mentors are really important in helping guide you. So that when you go to college, if you want to be pre-med, for example, finding an upperclassmate who's pre-med to help you, to guide you, to give you advice, I think is extremely helpful too.
What study habits would you say are successful or helpful to be successful in college, and to be prepared for college level courses?
I guess doing a lot of reading, just make it a part of your regular habits to read a lot, I think is the most helpful thing. It'll help you with their SATs. It'll help you with everything, doing well on tests. And then one thing that I did not do well as an undergrad, but did much better as a graduate student, was just establishing routines. So I worked a lot, especially when I was at the White House. I would work these crazy hours, like till 9 at night or something. And I knew I didn't want to do that. It was just too much. I was so tired. I wasn't doing any of the stuff that I really, outside of work, that I really loved. So I decided when I went to school, like I'm going to treat school like a job. I'm going to do it like 9 to 6. I'm going to try to get all my work done in that time frame. And, I just went to school. I stayed at school all day. And I, obviously socialize and things like that, but I tried to get all my work done in this time frame. And then I just like led a much healthier life. I thought like I could also do other things that I liked. Obviously, when exams and things come up, you study later into the night, but I think like just establishing routines where you're not sort of underdoing it or overdoing it, that's what worked for me, but I think you should figure out what routine works for you and try to roughly stick to it. But it takes a while. When you get to college, it's like you get all this freedom. It's a totally different environment. So I think it's okay to make mistakes and like figure stuff out. But hopefully by your like junior, senior year, you're really getting into your groove of how you work best.
You mentioned that in grad school grades don't matter as much. In high school and or undergraduate, like, do you think grades have more of a significance?
Yeah, definitely. So grades matter obviously in high school because it helps determine where you go to college. In undergrad, it matters. Grades matter. I'm not trying to say grades don't matter, but it shouldn't be your sole focus. As an undergrad, it matters if you want to go to like medical school or law school, those kind of schools, because so many people apply to those schools that they have to have some mechanism to filter, right? So I think they use GPA because it's easier to filter that way. So I think it like kind of depends on what your goals are. But I think, yeah, grades definitely matter in high school. So do well in high school. Grades matter more in undergrad. But I think as you get into like more and more education, like it doesn't matter as much in the future. Obviously, we all want to do well and do our best. And the grades are in part a reflection of that. But I think that you shouldn't pick your classes based on what grade you think you're going to get. Like you should pick classes based on your objectives.
Do you have any advice for some of us who might be undecided on a major or a path to follow? Do you think it would be a good idea to like take a year off to kind of decide?
I don't know if there's any parents listening. I'm not sure they'll like that. I personally thought I should have taken a year off. I think I would have done better, but there are a lot of reasons why that wouldn't work for everyone. I think if I were to go back to undergrad and do one thing differently, I think the first year I would have focused on getting those general education requirements done. So, when you go to college, just like high school, you have to take, X number of this type of class and all of this, kind of like 4 years of English, that kind of thing. So I would say when you're starting college, focus on those general education requirements because that'll help you figure out your study habits and all of that stuff. But if you take a really hard class your first semester, like that could sort of destabilize you when you're in school. So finding sort of intro level classes to ease your way into college, I think for me, what would have been better for me. So it depends on you, but that's one sort of reasonable way to start.
I was reading one of your reports from the American Progress regarding America's childhood obesity epidemic. Do you think that since 2010, New York's public health has seen growth from implementations like nutritional food plans?
I'm impressed that you read one of my reports, first of all. I think there have been different policies that have improved the trajectory of obesity in America. It hasn't really been my area of focus since I wrote those reports, but I think in New York City, there have been policies to focus on just transparency, like caloric intake. That was partly in the Affordable Care Act too. And just like trying to reduce the amount of like poor quality food people consume. I think there are things that those policies work, but I think also and then there are all these new drugs, right? There's like Ozempic and Wegovy and all these things that help people lose weight really quickly. So I think all of these together have improved where we are today compared to back then. But ultimately, we still live in a very unequal society inequality is so pronounced. And I think as long as that persists, it's really going to be hard to really sort of make it through the final stretch of some of these policy issues that we face if we live in such an unequal society.
Someone asked, what are some of the more urgent public health challenges in our present day that you believe should be addressed?
So healthcare costs, I think, are one big issue. They're out of control. So I think that's something that needs to definitely be addressed. Another issue, I'm trying to think. So I think our pandemic response like exposed a lot of gaps in our system. So our coverage gaps were huge. Our response was inadequate. Different populations were impacted differently, which again, going back to that the issue of inequality. So I think those are some really big issues. I think on the public health side, there are some solutions like from a like technological perspective that are really interesting, but I think if not everyone can actually access them, then that's a problem, right? So if Ozempic, Wegovy, all these things are out there, but if the people who really need them can't access them, that's a problem. I know climate change isn't like a clean public health issue, but I think the extreme heat that we face during the summers, I mean, clearly there are health impacts of that as well. So that's sort of a broader way to look at it. Those are just a few things off the top of my head.
What are some barriers or challenges that you face when addressing public health issues or emergencies?
Barriers, mainly political will or interference, I think is a big barrier. Like you see, again, you guys are, I'm sure, plugged into election politics and things like that. And unfortunately, they make people not really do the right thing or make difficult decisions. So I think that's something we encounter every day in policy, is that if your decision making is subject to a political force, then it's a lot harder to actually do the right thing and follow through on policies. There are some more independent agencies that have the ability to make decisions without political interference. But I think most agencies do have sort of an executive that directs them, and they're not always making the best choices. And then the other thing is like a stable funding source. So some of the most valuable policies are not well funded. So you'll see this more in like overdose issues, where the sort of evidence-based policies on overdose prevention are not being really well funded or sustainably. So then you can't really look at their long-term impact if they're not really in place long-term.
What types of careers do you think public policy making is relevant to?
So mainly if you want to work in public service, so if you want to work for the government, for a federal agency, for a state agency, and if you want to be in lobbying or advocacy, it's most relevant in those areas. I think it should be more relevant in other sectors too, like the tech sector, for example. I feel like they purport to have this public interest in mind, but if you don't have people who have actually thought about technology or its impacts from a public interest standpoint, I feel like you're not really effectively able to claim that you're doing things in the public interest. And I think you can see one area, like tech is a really good example of where it's absent, like that expertise doesn't really seem present enough given like all the adverse impacts like social media have on minors, for example, and women, girls. I think it's like a clear demonstration of the failure of tech to really think about policy and the impact of their technology on the public.
With the big interest in AI, are there any policies that you're aware of that relates to AI or the tech industry?
So there's very little that I don't think Congress has passed a law that regulates the tech industry in decades. So really there's very little, there are very few laws in that space in general. I think one area it's come up is in the health space, at least, is the way that we use AI to, I guess, like there's a clinical side of it, right? So there's AI that's helping improve diagnosis and things like that. There's also AI that can impact how insurance coverage is approved. So that's like a little bit of a gray area. AI also impacts in a clinical setting, clinical support tools like, and there's some, it could have like sort of a negative bias on how doctors treat certain patients and things like that. So it is definitely something a lot of people are talking about. It has been referenced in a lot of guidance, but I think in the policy space, people are still struggling with how exactly to regulate AI, because just saying like no to AI doesn't really make sense. Like it does have a lot of promise. Things could get better with AI. On the other hand, you don't want to make it so open-ended that there's no accountability. And I think that's the biggest issue in tech and AI is that there's no accountability for when things go wrong. And I think that's what's really important in public policy, is to create parameters or structures to keep us all in check for what we're doing.
Are there different types of public policy?
Yeah, so generally it's split up by the subject area. So there's health, there's climate, there's labor, there's, economic policy, financial policy. So they're generally split up by subject matter like that: education, transportation.
Where can someone go to look at draft policies that are out for public comment? Or is there like a suggestion box where we can propose a problem or solution?
So everything it's usually published on the Federal Register website, which is this like, I guess back in the day, there was something they actually published, or they might actually publish it today, but all of the regulations released by the federal government are published on the Federal Register website. With that said, I don't think it's like an easy thing for like a person who isn't looking for something to navigate. I think the best way to get engaged is if you figure out a policy area you're interested in, and then find like a think tank or advocacy organization that looks at that. They will flag things for you. So there are, like, if you're interested in immigration policy, there's the National Immigration Law Center. And anytime an important reg comes out, they like send out an email blast and encourage people to comment on it. So I think if you find an organization that's following the policy area you're interested in, that's probably the best way to start.
Are there county level or district level policies, or is it only state and federal?
Yeah, there's every level of government has policies. And actually the policies that impact you the most are probably local policies. So state, county, town, like most for example, education is very local. So in Maryland, for example, it's all based on your county where you live. In different states, it works differently. So a lot of the policies that are made at your county level, at your town level, impact your everyday life a lot more significantly than you probably understand. That's why that's like one of the things we've learned in the past few decades is that local elections are really important because they have a huge impact on so many things.
I remember you mentioned about how you wrote your thesis on infant mortality. I've heard about increased mortality rates in African American women during pregnancy. How is New York addressing like health equity concerns?
It's a really good question. So I think it's like a very much a multi-layered problem. So I think on one hand, access, trying to remove barriers to accessing care. So one thing people, one reason people think like lower income moms have a harder time is that they don't have sick leave to go to all their prenatal visits. So in New York this year, the governor announced mandatory paid sick leave for prenatal care. So that's one way. But I think that's probably like a smaller piece of the overall puzzle. I think the most important thing is holding hospitals and doctors accountable for what's happening. So I think doctors need to be held accountable for like the quality of care they're delivering patients. There's a lot of bias that patients talk about that they experience, especially when they talk about their symptoms. So I think there needs to be more accountability in the system, and that's complicated because it involves both like quantitative data, qualitative data that's accurate, that everybody sort of agrees on. So I think it's a long game issue, but I think, health insurance coverage, access to care, making sure people are able to go to those prenatal visits. I think those are some steps that'll help, but it's definitely a long game and like kind of changing mindsets on these issues.
Thank you so much. Does anyone else have any questions?
Wanted to actually add a small comment. So Anu here, she was actually involved in, so she's a student in high school, rising, I want to say sophomore. I keep forgetting between sophomore and junior. So rising junior, yes. But she has already went in and put in a comment, or she spoke up, advocate for light pollution. So Anu, if you can go a little bit into that and then see for those kids who are here. Thank you again, Sonia. I know you've been answering a lot of questions. But before we wrap up and give thanks officially, to give you a slight break, I know if you can go into a little bit of detail of what you did at the Senate when you went there to talk about the policy that they were trying to bring in.
I worked on a project with a local student nonprofit, and we are mostly focused on the environment in the county. So we were working on policy papers, and I chose light pollution as my issue that I was working on. And so we wrote a policy paper, and then we chose to testify for the Montgomery Board of Education. And we talked to them a lot about how schools can turn their lights off, or football fields, if they can turn their lights off a lot less or a lot more than how much they do now, because the amount of light that's focused on the school and the wildlife around it really affects animals and insects that are living in the area. So after that testimony in, I want to say September or October maybe, I was called back by our local senator at the Maryland General Assembly because he sponsored a bill on light pollution earlier this year, and he was looking for witnesses. So he asked me to come over to testify for a committee at the Maryland General Assembly. And so it was only 2 minutes where we were all about me. There was a lady from the Sierra Club. There was a guy who was from another organization, and the constituent who brought up the issue so that the policy could be talked about. And then we all gave testimonies. So that's what I've done. And I was looking for internships that I could do either here near like local governments or like statewide, but I couldn't really find anything that was like specifically what, like the ones that I found, you have to like reach out to your senator or reach out to local, like the Montgomery County office. So do you know any ways that like specifically we can look for internships in DC or like Annapolis or anywhere nearby?
Yeah, so I would say it's a little bit harder in high school because I think a lot of them are looking for college interns, but I think that the best way to the people who are most likely going to hire you are your representatives. So your member of Congress in their district office, your state representatives, and county representatives. I feel like that's sort of like a good place to start because even if they don't have anything available, they might be able to, they have sort of an incentive to try to help you find somewhere. So I think that's the first place to start. Yeah, I feel like when I was younger, like around your age, they did hire more people in that were in high school, but I feel like it's gotten a lot more competitive. So that might be one reason it's harder. But I can also think about it and follow up if I have other ideas. But yeah, my first thought would be to reach out to your representatives directly. And pause to say that sounds like a really cool experience being able to testify at a state house. That's extraordinary. So good job. And keep doing all of that. That's awesome.
Thank you. So to reach out to them, would we just have to like send out an email or like go there, or like how would we do that?
So first I would go to their websites to see if they advertise anything, because sometimes they do. If they don't, maybe calling would be better, because I feel like email, just like everybody gets so much email that it goes, you don't really know if there's anyone actually reading all of those email inboxes. So I'd say go to their website first. If there's nothing there, call, and then maybe email. And another thing to do, I don't know if you all are old enough to be on LinkedIn, but often you can, if you, I don't know how old you have to be on LinkedIn. Is it like 13 or 18 or, but that
I
would
don't
be
think
a,
there's a real age.
huh?
I don't think there's a real age because I know like people
Okay.
that are like,
So another thing to do is to, especially if you are on LinkedIn, I think it's useful to become friends with your, older friends who have careers and look at who they're connected to. And if you see that they're connected to a person you want to intern for, like you can ask them to set up like a connection. So, I mean, that's why I was going back to the point about relationships. So, for example, my the job I currently have, one of my you have to be 16 to be in LinkedIn. Okay, so once you're 16, you can start a LinkedIn account. But the main thing is to be connected through someone you know. That can be very helpful. So I got my current job because one of my mentors at CAP connected me to my current boss. That's really helpful because a lot of jobs, there's like thousands of people who apply to them, and it's very difficult to be able to sift through all those resumes and like pull you out. So that doesn't mean you're going to get the job. It just means that they're flagging you to the hiring manager, so they'll at least give you an interview. So that's really useful. And informational interviews are really useful too. So even if they don't have a job posted, you can ask for an informational interview at a place. And so that's where you just sort of let them know that you exist and that you're interested in what they do, and that they might think of you when a job does become available. So those are some suggestions, but it's really, yeah, like networking. The networking is like one of those things that can be annoying and especially stressful for some people because it's awkward. But I think like through people, there's a lot of people in the like Malayali community also that might work in places that you're interested in. Just like chatting with them about how to get connected, I think is really helpful too.
Does anybody have any more questions to ask? If so, just put in the chat real quick and we can read them off. And if not, we can go to ending the meeting. First of all, I would really like to thank Ms. Sonia Sekhar for, giving all the, taking time out of your schedule and sharing with us, letting us ask questions about things that we might need to know in the future. I also want to thank my co-hosts, Anjali and Anu, for, helping set up this meeting, along with KCS for helping set up this meeting, get contacts out. And I also would like to thank all of you for attending this meeting, because without you, we wouldn't really have anything to talk about. And if you have any questions, please feel free to contact us at kcsmw.org, or you can just reach out to any one of us personally. Once again, thank you for all of you for taking out time from your schedule to come here. And I hope you guys took something from this webinar.
We have one last question. Do you have
Right.
any last advice for all of us in high school?
Advice for high school. I have to think back. I'm a lot older than all of you. I feel like just by coming to this meeting, it says something about all of you that you probably are, doing the right thing. You're focused on the future, but try to also be grounded in where you are right now and sort of enjoy being where you are. Pursue what you're interested in. I think sometimes there's pressure to study certain subjects or go into certain careers, but what you end up finding out is that what you'll excel at is what you really like to do. So try to think about what you'd like to do and try to really cultivate those interests, because that's what you're really going to excel at in the long run. Although there are some people who are just like good at any kind of school. I was not one of those people. But I think most of us are good, excel at what we are passionate about. So there is some value in sort of cultivating your passions, whether it's in reading books about it or, testifying at hearings and pursuing public policy interests or volunteering, all of those things. I know some of it's like a resume builder, but even if you're just trying to build your resume, try to build it in an area that you actually care about or passionate about, because I think you'll get a lot farther in life if that's sort of how you make your decisions.
Thank you so much.
Hope that helps.